And I'm going to be presenting a little bit about the specifics of COVID and the way in which it has actually been weaponized. The first thing I'd like to do is share with you my screen. And the first thing I'd like to do is tell you about the 5 big lies. The 5 big lies are that China engineered the virus, or that China leaked the virus somehow by accident. There's also the lie that China covered up the virus. And this has 4 different variations: that it silenced whistleblowers, that it withheld knowledge of human-to-human transmission, it withheld knowledge of the genome, and that it didn't notify the rest of the world in a timely fashion. And then there's also the lie that China spread the virus deliberately, that it's still covering up the virus, and that it is opportunistically weaponizing the virus by hoarding PPE or by disrupting supply chains. So I'd like to show you that if we look at the timeline, we'll see that most of these lies can be seen for what they are, that they really don't have any validity. And the first, I'd like to show you a little timeline here. And if we can see here, we can see that the first outbreaks were somewhere between December 1st and December 8th. These are the confirmed outbreaks. They are allegations of earlier outbreaks, but these actually have not been confirmed, and some are considered to be bacterial infections, some are considered to be pneumonic plague. So this is the best estimate that we have. And we also note that on December 21st, we started to see the first cluster of patients. And then if we look on December 27th, we see that a Dr. Zhang Jixiang notifies the hospital of an unusual cluster of viral pneumonia. This goes to the Hubei Provincial Hospital, which convenes experts. They start a field investigation, and that results in a public health announcement on December 30th. And from that point, the Chinese government notifies the World Health Organization, and on January 1st, the US CDC is notified. Now, if we look at the sequence, we can debunk the allegation that there was some kind of cover-up. The cover-up comes from an article from the New York Times that alleges that an ophthalmologist by the name of Li Wenliang notified his colleagues in a private chat, and that hardly rises to the level of whistleblowing. But they allege that this information was suppressed. As we can see here, the actual notification, which was done by a professional, was by Dr. Zhang, and this was 3 days prior to Dr. Li Wenliang. So that argument does not hold. Another argument that is made, and this is by the Associated Press, is that human-to-human transmission information was suppressed. In order to do that, we have to look at the first outbreak. We had the first cluster, and then we start to see the first casualty. This was on January 9th. This was a man who was 61, and he had multiple comorbidities. He passed away on January 9th. And on January 14th, his wife contracted COVID. So this is the first confirmed human-to-human transmission. And then on January 20th, Zhong Nanshan, the public health expert, announces sustained human-to-human transmission. Now, the AP article alleges that during the 6-day period from the 14th to the 16th, the Chinese sat on this information, and this caused devastating harm to the rest of the world. What they fail to acknowledge is that there is a distinction between limited human-to-human transmission, as would happen within a family that is sharing a bed, that is sharing food, that is sharing the environment, that is spending all the time together. And sustained human-to-human transmission is what we really want to be watching out for when we are taking epidemic precautions. If we don't make a distinction between these two, then any outbreak of hepatitis or STDs would be cause for massive lockdown. So this is clearly a disingenuous argument, but AP glosses over the distinction, and that is why people are liable to be confused around this. The third lie is that China has withheld knowledge of the genome. Now, there were early sequences of the genome that were done before or late in December, but really the first sequence that was uploaded to GenBank, which is a public virus data bank, was on January 1st. So the allegation is that the information was withheld. And if we look at the timeline again, we can see that the Chinese government gave information about the human-to-human transmission on the 20th. On the 22nd, people in Wuhan were told to wear masks. On the 23rd, there was a total quarantine of the city of Wuhan. All outbound traffic was frozen. And then on the 25th, there were 10 provinces that declared a public health emergency. New Year's events were canceled. 5 cities were quarantined, and 58 million people were affected. And Xi Jinping declared it was a grave situation. Now, if that was not warning enough to the United States, we also know that there were the Red Dawn emails that were circulating on January 29th. And in one of these emails, Peter Navarro warned that there would be 500,000 people dead in the United States from COVID. And on the 30th, the WHO declared a global health emergency, and Health and Human Services, Alexander Azar, warned that there would be a pandemic. So once again, we can see that this information was widely circulated. It was widely known at the highest levels of the US government. So to allege that China had somehow withheld this information or that it is silenced whistleblowers, none of this information upholds. But there are actually endless variations of these lies. They've all have been debunked or shown to be without merit. But as you can see, we can easily debunk these from timelines and public announcements. This ties into the current situation that we're at, which has to do with the idea of narrative dominance, of information warfare under full spectrum dominance. The key point that these lies are trying to allege is that the virus is China's responsibility. And this has to do with the fact that China has been declared a revisionist power, i.e. an official enemy. And this is part of the gray zone warfare, the hybrid warfare, the information warfare that is happening. So we are facing a very transitional point in global affairs, and we have to be aware that these lies have a tremendous effect. I will leave you with a quote from William Casey. He said, "We'll know our disinformation program is complete when everything the American public believes is false. And those who would have you believe absurdities are preparing you for atrocities. In war, the first casualty is truth." And I'll leave you with one last saying, a Chinese saying: derive truth from facts. Thank you.